We want to talk about the pandemic nearing year 2 of the coronavirus pandemic, and we've seen cases rise and fall several times, the latest being the growing number of cases tied to the new Omicron variant. But could that surge be on its way out here in the Bay State? Western Mass News reporter Amanda Callahan getting answers from a local health expert.
I think it's relatively good news that it does appear that the Omicron surge in terms of new cases per day and hospitalizations has peaked.
COVID-19 cases and hospitalizations reaching a peak in early January thanks to the highly contagious Omicron variant widespread across the U.S. Cases here in Massachusetts coming in at a high of over 28,000 on January 10th, and hospitals treating a high of over 3,300 patients just days later on the 14th. But after reaching a tipping point in hospitals here in Western Mass, things are beginning to look up. Hospitalizations dropping by nearly 1,000 in the past 2 weeks.
At Mercy, the peak that we saw during this surge, we had over 60 hospitalized patients on a given day. Now we're about half of that. We are about 30 to 32 hospitalized cases currently. And, my projections would be that those continue to go down somewhat.
Western Mass News reached out to Dr. Robert Roos of Mercy Medical Center to get a better understanding of how Massachusetts tracks COVID hospitalizations.
From a hospital's perspective, we treat all patients that are in the hospital with COVID the same, whether they were there receiving treatment for COVID, specifically with remdesivir or other medications, and that is the primary reason for their hospitalization, or if they were there for something else, but diagnosed and thought to be infectious with COVID during the hospitalization.
Dr. Roos referring to the State Department of Health's change in recording COVID-19 hospitalizations. Beginning on January 10th, patients are differentiated by primary or incidental cases. The difference being whether a patient receives a steroid called dexamethasone while they are in the hospital to treat the virus. A specific measure, Dr. Roos tells Western Mass News, is not a full picture of what it means to be hospitalized for COVID-19.
Not every patient on a given day, is receiving dexamethasone, but still that COVID can be significant. They can have symptoms, and that may be somebody that we need to ensure is properly isolated and can spread it to other people. So to pin it only on the dexamethasone, to me, is not fully representative of the type of care and necessarily the seriousness that COVID still poses to some people in our community.
Dr. Roos adds all patients positive for COVID are treated in some way when seeking care at a hospital, such as isolation, safety measures for healthcare workers, or other treatments.
They're receiving some type of treatment for that COVID while they're here. It's whether it's oxygen, it's steroids at some points, maybe they're not on steroids at that moment, remdesivir, which can be used for mild and moderate disease now.
Reporting in Springfield, Amanda Callahan, Western Mass News.